Let us start. Asilia, Kamurade, greetings. Ladies and gentlemen, I welcome you to this day, history, first day, to this year first held symposium. My name is PJ Echno, and I will be your master of ceremony this afternoon. Before we move forward to our official program for this day, let me express and show my respect to Almighty God and the traditional leaders of Pohnpei in my mother tongue. Iyang Asileria, ay tuwad sa aradan kay mani tan kumuran sa matay po. Wound up, hokapin, welcome masan-san na may isang mga. Ay tuwad sa aradan kay mani, wound up, tan kumuran kalat ako Pohnpei. Isoko, na likat ko, nanalang ko, likat ko. O sabon mga kay Toros ng bilyan siya. Protong ng Jen Basut. Ay tuwad sa aradan, wound up, tan kumuran kabina. And when Pohnpei, the Honorable Stevenson Joseph. Bounty, Karyang Kabina, Warak, First Lady, Caprela, Juan Sakaradan Wawat, Pindona Shed, Chief Justice Ahmed, Associate Judge Nikon Johnny, Mayang Kat, the Young Child Branch. Also, Wawiki, William W.H. Joe, Secretary Samo. My respect to Secretary Samo and the WHO rep, Mr. Alfred Working. Let me express my sincere thanks to the Dean of the Diplomatic Corps and the member of the Diplomatic Corps. Thank you guys for joining us this afternoon. We gather here with a shared commitment to strengthen the health system, improve the community well-being, and collaborate for a healthier future of all Pohnpei, especially at the city. Today and the next 2 days reflect our shared commitment to strengthen our health system and improve collaboration. Alanganin po provide ramage. Before we move on to our official program, I would like to call the Honorable Judge or President of the UCCP Pohnpei to lead us in the opening prayer for the invocation.
Let's rise for prayer. That's all. Rise. Let's pray together. Sa Quran, sa kita kapun, maring sawasan rawat maing sama kalangan. Katran kapun kan, nagtaptar na palaton maring ng rawat ko na tang sa o kapun kan may pampat-patot. Ay samat ko kalangan sa panaman kabrami patrangat kapuna lapalapakan meron pa na dyan katkatiyan tuwan wayapan kapalpan palawat o samtaykan nagpet yaya sa mga winaro so tukit makot sang karas kan palsang remon ay masapati ang sa uksat kemudian katanya yang kat ketongkat saban mamerosan ay paluan rosanan mata-mata o rosanan ngay saraw besan ka tratrakin niat pan kat-katiyan tatangkan makonangan uyawiyang apal panarams sebagai saban mamagkaway Sangirail kan mataan mo yung kaway. Sangkit kan mataan rorong kaway kan. Pasan ka kolati o tatangkit ang kan. Maing sa mga kalangan sa pagi ang kating kamanalan kapayatan dia kemudian katerangan napawapin paanpat patolan ang rangan at tungal kapen at tungal pagpagsawas ang patabat rin ang sa mga kalangan ibig man waliang tiyaman naman kay pagi kami ang kating kubura law ang kuburkan sa karatan ng mga naman kit may panapaan ko pramong rin sa wasan ram. Kamkat kayang ko pramoy o katan kapayat. Kamkat kan kasarawiyala o yayang katuwat nawa pa ng sakla. Wasakan may sakarata sa kalaliyat. Kamkat kan maangi o kat kayang ko pramoy ben kapayat. Ay tungal sakarataman ako pramoy ang paitan. Nilang kapay ang Saban Maria Rosa at Santa Lord Jesus Christ may sabat kita. Please with that.
Thank you, Honorable Judge. President of UCCP. May I call upon Pohnpei Esteemed Choir to lead us in the Pohnpei Hymn. And once again, ladies and gentlemen, let's rise for the national Pohnpei Hymn. Thank you. Thank you, SPA Choir, for always beautiful rendition of the Pohnpei Hymn. Before we move forward, and before I call upon our guest speaker on the agenda this afternoon, my apologies. I would also like to recognize the international partners, our union, home country hub is here, and the cabinet members. I don't want to get in trouble after today, so sorry about that. So may I, at this time, I would like to invite the great man, the man behind everything else that's happening here, our great director, Mr. Stuart Benitez. for the welcoming remarks.
Pagkakalikan Chairman Joe Manugulong PMC. Ibinwag ko kita Chairman Manugulong PMC STE Pohnpei. Kailangan din po. Asilelia Maigo and Tomarano. First and foremost, let us acknowledge with deep respect the custodians of this land and our traditional leaders whose wisdom continues to guide us. Ritual Wow, Panguburan Honorable Governor Joseph, First Lady Dr. Aina Korstan, Lieutenant Governor Erelina Smovic, Honorable Speaker Yamaguchi, Mendaje Hichabiliang Kachwasaj, distinguished members of the 11th Pohnpei State Legislature, Chief Justice, Associate Justices of the Pohnpei Supreme Court, Honorable Marcus Samo, Secretary of the Emerson Department of Health and Social Affairs, Cabinet members, both state and national, team and members of the Diplomatic Corps, Reverend Nigon Truchani and esteemed members of the clergy, our UN partners, Dr. Oprin, WHO representative to the Northern Micronesia Office, Director Willie Costiga, Kalangan ng Komisulaga, Ms. Shanti Sikra, WBA Manager and TNC, Awaliban in Government Relations, CSO and NGO representatives, Dr. Nia, colleagues, and friends. It is with great honor and humility that I welcome you all to the first Pohnpei Health Symposium. Today marks a historic step forward for Pohnpei State as we come together, leaders, health professionals, community representatives, and global partners united by a single purpose: to transform health for all Pohnpeians. Our theme, Transforming Health for All Pohnpeians, bridging gaps with local wisdom and building systems with global standards, captures the very spirit of our journey. It reminds us that true progress must be rooted in the strength of our people and culture, while also drawing from the best practices and innovations of the world. This symposium is more than a gathering. It is an opportunity to reflect on our challenges, celebrate our achievements, and chart a shared path forward. Together, we will explore how to bridge the gaps in our health systems, how to integrate the wisdom of our traditions with the standards of modern medicine, and how to ensure that Pohnpeians have access to quality health care. On behalf of the Department of Health and Social Services, I extend our deepest appreciation to each of you for your presence here today. Your commitment, partnership, and contributions will help us build a healthier, stronger, and more resilient Pohnpei. Kalangan, and welcome to the first Pohnpei Health Symposium.
Maybe we can open the back door since we'll let air free. Let some breeze come in more. Kailangan ng I so at this time, I would like to call upon, I said the great supporter of this program, but this one is the biggest supporter. The great governor. Our great governor. The Honorable Stevenson A. Joseph.
Good afternoon, everyone. Please allow me to associate myself with the previous speakers, namely our good reference, as he acknowledged my master ceremony, Mr. Ednon, and the remarks made by Director in recognizing the words of courtesy to our distinguished guests, those of you that traveled here, those of you that reside here, partners. Let me just associate myself with that. Remarks of recognition, courtesy, and wow. Kasidelia Mainko, distinguished guests, health professionals, international partners, diplomatic officials, and community stakeholders. Good afternoon. It is my great honor to welcome you all, joining Director Peñas, to the first ever Pohnpei State Health Symposium. This is an historical gathering for our state. For the first time, we are bringing together policymakers, health professionals and practitioners, community stakeholders, and our international partners to align our health priorities at the policy level. In the case of healthcare, policies are sometimes conceived and formulated with little or no collaboration amongst the levels of government, stakeholders, and sometimes between policymakers and health practitioners, consequently giving rise to competing priorities, hence creating confusion and resulting in subpar policy implementation. As a result of this incoherency, missed opportunities and wasted resources are realized. We need to do a better job in aligning policies from top down, bottom up, and across all sectors and stakeholders to ensure our health professionals and practitioners at all levels have clarity and empowered to do what they do best and are trained for. And that is to prevent our people from getting sick and or provide the needed care. For the Joseph and Movic administration, addressing and changing the trajectory of non-communicable disease is one of our highest priorities. Too many of our people are plagued by diabetes, hypertension, heart disease, and other preventable illnesses. These challenges not only threaten the lives of our citizens, but also place a heavy burden on our families, communities, and economy. The last I checked, our statistics are not that encouraging. It seems we are stuck in a cycle. We are stuck in a cycle, and we can't get ourselves out of it. So, what do we do? How can we break out of this cycle? Are our collective policies and strategies working? I believe we all know the answers to these questions. So, let me be the first to suggest some answers. No, I do not believe our current policies and strategies are working. I think we need bolder and more aggressive policies across all sectors, not just health, to curb NCD. We need to acknowledge that NCD is an existential and imminent threat to our children. The beautiful thing about this threat, unlike some other talked about threat, is that we can actually do something about it, even at our level and with the resources we already have. We need not to pander or appeal or even rely on bigger and healthier countries to make a difference. We can make a difference now. We have control. All we need, aside from the resources, is the will and the commitment. I want to express my deep gratitude to Director of Health Stewart Peñas and his team for their vision and tireless work to make this symposium a reality. Their dedication reflects at the forefront of our agenda. I wish I want to express my deep gratitude to the Director of Health, Stuart Peñas, and his entire staff for their vision and tireless work to make the symposium a reality. Their dedication reflects the commitment of the Pohnpei State Government to put health at the forefront of our agenda. I wish to also extend my gratitude to our development partners and advisors. We value your input and support. The symposium gives us an opportunity to discuss these issues openly, share best practices with our partners, and change or develop policies to support our strategies to help us turn the tide of what I call the NCT tsunami. I am particularly encouraged that our international and diplomatic partners are here with us today. Your presence is a testament to the shared commitment to improving health outcomes, not just in Pohnpei, but across our region. Please listen to the conversations and help us develop better policies to empower our healthcare system to serve our people better for a healthier Pohnpei. But I also want to emphasize this. What we discuss here must not stay here. The policies, ideas, and strategies we explore must be put into action in our clinics, in our schools, in our communities, and every corner of Pohnpei. Only then we will see meaningful change. Together, let us use this symposium as a starting point for a healthier, stronger, and more resilient Pohnpei. I now declare the Pohnpei Health Symposium open. I wish you all the best. May you all have a productive and inspiring discussion in the next couple of days. And it is my hope that the outcomes that will come out of this symposium will move us in the right direction. Kalangan, thank you.
Thank you, Governor, for inspiring word. For the call for action, not just action, collaboration. No more words, but actions speak louder than words. In the next 3 days, we will use those words and lead us to the next chapter of the health and well-being of the people of Pohnpei under your chosen and molded administration. This afternoon, we are honored to hear from one of our key international partners, the World Health Organization. The World Health Organization continues to play a vital role in supporting health initiatives across our Pacific region, from all the way to here home. Please join me in welcoming the representative, the WHO representative for Northern Micronesia, Dr. Alfred Rodrigo. Let's give it up.
Okay, I have to speak louder than usual. Honorable Governor Stevenson Joseph, the First Lady Dr. Raina, Lieutenant Governor Movek, Honorable Secretary Marcos Samo, Director Stuart Peñas, our Reverend, traditional leaders, diplomats, development partners, government officials, youth representatives, health professionals, and community members. Kaselele. It is with deep gratitude and genuine excitement that I stand before you today. This is not only my first visit to Pohnpei, but also the first event I have the honor of attending in the Federated States of Micronesia. And I could not have asked for a more meaningful beginning. To be welcomed into this vibrant community at the first Pohnpei Health Symposium is a true privilege. The warmth of your hospitality, the richness of your traditions, and the strength of your collective commitment to health are truly inspiring. The theme of this symposium, Transforming Health for All Pohnpeians, Bridging Gaps with Local Wisdom, and Building Systems with Global Standards, speaks to a vision that is both bold and beautifully balanced. It recognizes the path to better health is not only paved with policies, science and technology systems, but also with wisdom, values, traditions, and voices of the people. Over the next few days, we will engage in critical conversations on the health system strengthening, health financing, health technologies, including AI possibly, workforce development, and community engagement to try and solve the points that the governor has already said. How do these all come together to solve NCD as a problem, to solve immunization, to end communicable diseases that are on the verge of ending? We will hear from you, elders, clinicians, and policymakers.
Unknown caller.
Together, we will reflect on challenges, but more importantly, we have to co-create solutions. Solutions that we all agree on, not impose. As a WHO representative, I want to affirm our unwavering commitment to walk alongside you in this journey. WHO is here to support your efforts to build resilient, inclusive, and people-centered health systems that honor local realities while embracing global standards. Let this symposium be more than a meeting of minds. Let it be a celebration of shared purpose, a spark for innovation, and a foundation for lasting partnerships, a beginning for a call to action. Thank you once again for your warm welcome. I look forward to learning and listening from you, working with you, and supporting the health and well-being of Pohnpei. Kalang.
And at this time on our agenda, it's one of the main, called the main event, one of the speeches that it's really, really important when there's a gathering. So it's my honor and blessed and fortunate to have the Honorable Secretary of Health, the Honorable Marcus Samo, to join us this afternoon to provide this keynote speech. Let's welcome Honorable Secretary Samo.
Okay, I will have to speak very, very loud. Can you hear me in the back? Well, I normally whisper, but I'll try my best to speak as loud as I can. Hopefully magic will happen. Please also allow me to follow suit. Say a few words of acknowledgement. Good afternoon. Kasalelia Maiko Kamoral. Let me begin by first giving thanks to our Heavenly Father for His mercy and gift of life, allowing us to be here today this afternoon. I pay respect to the traditional leaders of this land, Pohnpei, church leaders, and government leaders. Tiro the Honorable Stephen Joseph, Governor of Pohnpei State, First Lady Dr. Aina Karstan, the Honorable Lieutenant Governor of Pohnpei, Ms. Erlen Movic, Reverend Stephen Trojani, Speaker Marvin Yamaguchi, Dean and members of the Diplomatic Corps, the new WHO representative for the Northern Micronesia, Dr. Rodrigo Offrin, our development partners present here, as the WHO, of course, UNICEF, UNFPA, SPC, but there are probably others that I don't see.
Of course, the man of the hour, Director Stuart Phineas, my good friend, and all of the cabinet members present this afternoon. Staff of Pohnpei State Department of Health Services, and Deputy Director Shira Sikra from Pushra, thank you for making yourself available this afternoon. I'd also like to recognize a few individuals that we lost track of each other. They're now in the room. I see Shanti Sikra, I see Nia somewhere. It's great to see all of you circling back to the Pacific, or the FSM, rather. Colleagues, ladies and gentlemen, when Director Stewart asked me to be the keynote speaker, and I told him, I said, well, haven't you been tired of me? We've been together all this time. What else do you want me to say? And I also ran into Governor Joseph, Stephen Joseph. I asked him, what do you want me to say at the health symposium, the first health symposium? And he said, anything you want. So ladies and gentlemen, you're in trouble. Really, because I'm going to say anything I want that comes to my mind. Indeed, it's an honor for me to be here, standing before you during this first Pohnpei Health Symposium. I must warn you, ahead of time, if you expect me to dispel new ideas or information, you will be very disappointed. I will talk story with you based on my experience and observation throughout the years in health. And much of my story is already known. You know it. My talk or story centers on the topic of health system strengthening or improvement. I must be careful because WHO is in the house. And they have definition of any word, every term, everything, every concept, every model. My perspective on this topic may not be exactly what they prescribe as the mantra of health system strengthening, especially as it relates to one of the global agenda on universal health coverage, which is the idea that any government, a country or area must be able to identify the minimum set of healthcare for its own people, its own population, and make sure that that particular minimum set is available to its people at all times without hardship, without difficulty. Of course, I'm paraphrasing it. But to me, that's easier said than done. Instead of saying this should be the minimum set of services for our people, we should focus on this, not that, I'd like to focus my talk on the critical elements of a health system. The WHO calls this health system strengthening framework. In other words, what are the critical elements or building blocks, that's the word they use, that make up of a health delivery system in a country? What are the weak points? What are the strong points? What lessons have we learned that we should not repeat? Rather, what are the best practices that we should repeat, we should replicate? Hopefully, by taking that approach, by examining our own health system, using that framework, we provide opportunities for you and me to reflect on how each one of us can contribute to the theme of this symposium, transforming health for all Pohnpeians, bridging gaps with local wisdom and building systems with global standards. Let me do a bit of reflection. Let me kind of take you back a little bit. And let's reflect on some past events or achievements, if you may, in order for me to make my point. Here are some facts, and I'd like to believe that we generally agree on this. Let me say each one of them. Can you give me kind of a funny look and nod if you generally agree? All right? So some facts. Number one, as a population, we live longer. from 1960 to present time, our average lifespan has increased from 60 years old to 70 years old. Do you agree? Yeah? We have lived longer, there's no doubt about it. Number two, we have more money today than before. You agree? Yes. Household health expenditure has increased substantially. Do you agree? I think so. Today, we're able to control parasitic, waterborne, and vaccine-preventable diseases, and those caused by malnutrition and poor sanitation to an extent. I think we're doing quite well in that department, right? Okay, good. We're on track. Another one, number of children died during the first year of life. In other words, infant mortality. Or before they reach 5 years old, has also declined substantially. Do you agree? You said yes, right? Yes. That has improved quite a bit. Per capita expenditure. Per capita health expenditure. In other words, all the money in this country divided by each one of us has also increased, right? Yeah. I'm not asking what it's used for, but it's increased. Okay? Today, we have better access to internet and digital technology. You agree? Okay. Today, we have better access to higher education. We have more people trained in the health field compared to before. I think so. And everybody should know. We have our own college and campuses in all the states. Right. And this is a good one. There are more women in medical health related fields today than before. Yeah. Yeah. Another one. More women in decision making to leadership position in our government. Right? We have access to good tertiary hospitals abroad. Where's my care? My care is in the house, right? And those insurance. Okay. I'm not asking what those services are, but I just say more of us we tend to be mobile. We're a mobile population. Yes? Very mobile. And another one, infrastructure is better now. Okay? We have more employees in the health sector compared to any other time. And last, let's pick a few. There is an increase in demand for better quality healthcare. You agree? And I think that's the point I'd like to kind of keep it in the back of your mind. Huh? So why am I saying all this? My point is, with all due respect, we've already been transformed. Much has happened in the last 50 years or so. I will just use it as an example. You would recall that we used to get free medical doctors, nurses, and other specialists through the U.S. federal government, U.S. government, the U.S. public health services. That's no longer available to us. It's not that they don't like it. It's not that they don't want to give it to us, but they believe we can stand on our own feet. We're able to train our own. Okay? Today we have been able to train our own, and most of them return home to practice. Those sent on refugee and other places, I think 100% of them return home. Well, except maybe only a few were trained elsewhere other than Fiji. We own the business of providing for ourselves now. Yes, we hire and bring in health workers from abroad, but we do this on our terms and our own merits. It's no longer done for us anymore, as it used to be. See, to me, to transform implies to change from what was to what is. Move from here to there, or from here to there. Is it possible that our expectation of what our health systems should provide and what we actually receive don't match? So I will use the framework that the evaluators use as the building blocks for us to kind of reflect on what we have in country. The base essentially six what they call building blocks or elements. First is about service. Okay? This includes both hospital-based and public health services. The point here is that these services must be appropriate, affordable, accessible, and remain relevant and meet the needs of the people throughout their life course. And allow me just to kind of touch on a few examples that I know, or at least that we've taught within our health circle. I think it's true that Pohnpei Hospital has pretty much everything what is expected of a general and community medical facility for a population 35, 36, 40,000 or so. It is designed to provide urgent or emergency care, delivery, inpatient care, dental, and surgical services. You even provide dialysis services and expensive operation, suggesting that the population health status has shifted to a more chronic disease model. While each of these departments within the hospital is truly based on needs, I am sure there is room for improvement. The facility, for example, hospital itself, was built I think roughly 40 or 50 years ago. Is it possible that it may have outlived its life? Or in need of a major upgrade? Or a new one? At the public health side, you pretty much have all the public health programs for a population like this. Preventative programs. But if we start to dissect each of these areas within the block, you will notice that our vaccination coverage for school-aged children is not at the level that we would want. There is spike in some communicable diseases despite increase in awareness and knowledge of how to prevent their spread. Example like TB and HIV and other STDs. Individuals as young as 40 years old are developing complications of diabetes, something that you would normally see among the 60 to 70 years old. Only 20% of all pregnant women each year actually receive the recommended number of prenatal care, even though their risk may be higher. Some of our other islands are not visited regularly. Hence, the medicines and supplies that should be available throughout the year are not available. Pohnpei still has a good primary health care setup throughout the main island and the outer island. You just need to make sure the relevant services are provided and sustained. So let me touch the second block. It's about manpower and workforce. You cannot run or have a good health facility without well-trained, skilled personnel. And I'd like to throw in three words to the mix. Besides skilled. The skilled to me implies you can train them up. But there are also some abstract things that it's difficult to train an individual to become. And that's about conscientious, caring, and the compassionate service provider. Those areas, those values difficult to train. It's something that, I don't know, maybe over time you pick up. But to me, those three values are equally important for somebody to be competent and skilled personnel. Are our medical doctors and nurses equipped with the right tools and resources to be the best they can be? I think if we ask 1 or 3 doctors, they probably say, no, we need more of this, we need more of that. Do we have enough general doctors? Do we have enough specialists. For example, perhaps this is an area that really need a boost to train up individuals to be specialists. While we are appreciative of the different visiting specialty medical teams, this is an indication we need more specialists as a country, as we mature, as we grow. I said there were 6 blocks, right? So this is the third one. Health information system. Are we making policy decisions based on reliable and accurate information? Is there evidence for our decision? Do we have a system or process in place that helps in production, analysis, and dissemination and monitoring systems performance and health population health status over time? Again, I tell you earlier, you're going to be disappointed because I'm asking questions not giving you answers. Again, technology has transformed the way we do business. E-banking, e-health, telemedicine, telehealth, even in all our public hospitals, they're all on the same network. If I go to True, I'm seen by a doctor, and Dr. True should be able to pull up my records. And see, Marcus, you were seen by Dr. Iche the last 3 months, guess what he gave you? And this is when you came back, this is what happened to you. That connectivity has improved quite a bit, and it should be making life easier for the healthcare providers. I'd like to mention an example, and I really want to thank the leadership of Pohnpei State, not just director, but the entire leadership of Pohnpei. I'm not sure if you're aware that right now at Pohnpei State Hospital, we call it telepathology. Right? At Pohnpei State, because we do not have a pathologist anywhere in this country, it's expensive. Pohnpei State is now able, after setting up a small room in the lab with sophisticated equipment, and then a few medical staff trained up, we stole somebody from Fiji and brought here and then helped train up our local staff. So what happened is, when it comes to biopsies, they do the samples, they process it, at Pohnpei State Hospital, digitize it, and then that image is actually sent overseas to a pathologist. These are specialists that will look at the cells, look at the image, and be able to tell you what it is, cancerous or not. In the day, it used to take months. Today, it could be days or hours after the Pohnpei State lab folks have a real-time consultation with the pathologists overseas. In Japan, by the way, because the company is working. And the turnover response is instantaneous. That information is then given to the doctors. Okay? Doctors should be able to use that info to care for and to treat that patient. So, should like to tap you on the shoulder, Pohnpei State, because you house them. And it doesn't happen by accident. It's over a lot of work, a lot of negotiation, a lot of purchasing, because it costs a lot of money to get those equipment. And then the fourth is about products, vaccines, and technologies. This basically means, do you have enough to buy the consumables, the medicines that you need? What are the latest medicines that you should have? Are you able to purchase these state-of-the-art medicines, or will you be able to treat cancer, treat other medical conditions that perhaps are more prevalent than before? Notice it's getting harder here. The fifth one is financing. Financing basically, as you all know, money, 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 but resources, resources. How you turn that good resource to get something out of it. There were times when funds are not available on time. For better planning, this must be changed. You cannot run a hospital when you do not have a budget, or when the budget is not received on time. I'd like to use MyCare as an example, because it's about money. MyCare is actually like a strong player now in health financing now in the country. I could be wrong, but my last information is MyCare collects at that time, perhaps more now, roughly $8 million a year. And most of that is from members in Pohnpei. 80% of that is sent of Highland, by the way, for referral. For the remaining that is spent on island, 80% is spent here at home, here in Pohnpei. It's quite a substantial amount of money. Sending money overseas will continue for a while, unless we do something about the competence, skills, and comfort level of our medical providers at home, including building or beefing up the diagnostic infrastructure and capabilities here. The last variable in the equation, the last building block, has to do with leadership and governance. It's very effective. Any organization, you need technical leadership and servant leadership style. I don't know what's more prevalent here, but that leadership ability in an organization is key. And healthcare organization is no different. So effective governance and leadership are essential. Everyone must be accountable to someone. All of us are accountable to the people we serve. Our success should be measured by them. So, what are the lessons learned over the years that can help us strengthen our health system? Again, I'm not giving you solutions, I'm just throwing in questions. Some thoughts for me when it comes to transformation. It's difficult to transform if those responsible for change don't change themselves. Right? And I think this is key in leadership. It's key in any organization management, and it's key definitely when we're trying to instill change management organization model. If you want to reform or change or transform, business as usual is unacceptable. Transformation requires increase in financial and human capital. It's difficult to transform if we are not convinced it's worth it. It's difficult to transform if you don't have the buy-ins from our stakeholders. It's difficult to transform if we change the rules or policy in the middle of implementation. It's difficult to transform if we are not focused. It's difficult to transform if we don't pay attention to the critical steps of the journey along the way. Lastly, transformation does not happen overnight. Coming to the end. Is Pohnpei State in better position today to advance a reform agenda? Just my thought. I believe so. I believe so. For several reasons. Let me share a few of them. Pohnpei is a melting pot of culture and home to international communities and partnerships. It's a gateway to FSM opportunities with different level of expectations and demand for better healthcare. There is presence of private healthcare providers on this land, on this island, compared to other FSM states. Although it might not be that significant, but there is presence of private providers. Communities are already organized and resilient. A strong traditional system that guides and supports your work. This contributes to your overall chance of success in life. Another one. Pohnpei has more disposable income, buying power, compared to any other FSM states. The last household income expenditure survey showed that more people in Pohnpei are paying for healthcare out of their pockets compared to other states. In other words, even though they may be insured, even though the Pohnpei state might say, okay, just pay a little, more people are actually getting out their paycheck or checkbook or cash, pay for that care. more people on this island compared to other Muslim states. Another point, there are more Pohnpeian medical graduates than any other states, and more are in pipeline compared to other states. When I say other states, basically the 3 Muslim states. If you continue this path, Pohnpei will not only produce enough medical doctors, but will also be the supplier of doctors for the rest of the embassy. This is an advantage for Pohnpei and an investment for the nation. Use it for your advantage toward your transformative agenda. Unleash the power, the spirit, the community spirit already there. Again, it's a reflection. Let me just tell a story. During the COVID time, because it brings everything home, right? And it's great nothing will happen. Right? You know, in the beginning, basically the world was nobody really knows. Everybody rushed to do this, right? Closing borders, erecting new hospitals. Some countries were successfully building massive facilities in 20 days. They have the resources, they didn't have any of that. We're thankful to our partners who stepped in to support us. That level of support we really appreciate for our donor partners. Thank you to all the missions. But the point I wanted to bring home is this. And I saw the tears in some of my local doctors. I didn't want to say it, because they were worried. What would happen if our people finally, as everybody's dying? And how are we going to deal with it? They were banking or looking for support, technical advice from other donor partners. People that they thought they were in position to help. But what happened? They were the first to leave the country. I'm not saying that in a negative way. You've got to be able to help yourself first. Do not rely on things. The help will come late. But when things happen, all hands on deck. Take care of your home first. Position yourself. And count on resources you have at home. They're your best allies. So I just want to kind of pull that because that's what all of us will always have to think about. I believe there are also other forces within the FSM as a whole that I think should be contributing factors to this effort of Pohnpei State. First, health symposium. Let me also share some of it. This is as our nation as a whole. As you know, we have been able to put away money for the future, right? This is the trust funds that we all know, schemes. We never did this before. I'm not saying how we're going to use it. How it's going to be divided up. The very fact that it's safe, it's there, built earning money, that's a good thing. It's something we should always use. Maybe the next generation of leadership think about it, so that you can plan for it. And we have more willing partners around the table in the room that are willing to step up and support us. And then something that Director Stewart and I know very well. We know that the funding for some of our partners, like the U.S. federal programs and other international finance, have actually increased over the years. We have to implement these programs so that we can decrease reduce the number of NCT cases or be able to not let them go on dialysis and things like that. So we have preventative programs. We should be able to implement them because there's more resources. The infrastructure in Pohnpei is a lot better compared to other states and compared to years in the past. And one that I actually like is Pohnpei is the host of the nation's capital. So make use of that. So ladies and gentlemen, I know it's getting warm. I know I'm not giving you any new wisdom, new knowledge, new things. It's just a different way of saying things that you heard. Point is, national agenda is important, and we all should back together to help Pohnpei State this time. I have to say, also the nation as a whole, because I work for the national government, all of us have a responsibility to transform health. So in closing, we must invest in health, both public health and clinical medicine. It's good for our economy, and it ensures better health outcomes. We must invest in our own people to be specialists also. If you want them to be the best physicians, give them the right tools and training. Doctors and nurses also have moral responsibility to gain new skills to be competent for the 21st century and beyond. Pohnpei has a good primary healthcare system set. Community and traditional support systems necessary to sustain its operation to the next level. It's very strong. This can be a model for the rest of the states. As long as you go full blast today, all hands on deck, and aim high to achieve more, you're heading in the right direction. To me, everyone should be reform-minded with eyes set on the future. To transform healthcare, we must not settle for status quo or business as usual. We must posture the health system and policies in a way that is forward-looking, ensuring that future leadership will pick up from where we left off. Thank you for this opportunity, and I apologize if I drive you to sleep. Thank you very much.
Thank you, Mr. Honorable Secretary Sabo. That is the end of our official program. Before I let you go, we have the best part now, the announcements. Maybe tonight at 6 p.m. saying we invite everybody. Please come back. We don't want to heat the crap by yourself. So please come back, join us. Please come back. We have a dinner reception, and another part of our program will also be held tonight at this reception. The held snapshot after this thing. Maybe the next symposium will be on utility, because this is really hot right now. Before I adjourn, I would like to thank everybody on behalf of Director Stewart, the Chief of the Department of Health and Social Services. We thank you guys for coming. This is not the end of today. This is just the beginning. The next 2 days will be lots of great discussion. So please come back. And that concludes our official program for this afternoon. Alangan para lang. The reception's here tonight.
Oh no. Hey, my friend.
I would also like to ask